Hi, my name is Sarah. I am the mom to a 2-year-old named Mick, and I'm going to talk to you today about a supplemental nutrition system, or what's commonly known as an SNS. So a little bit about my background and why I know about an SNS is because I had extreme lactation issues due to some serious birth injuries. I didn't quite start lactating the way that I was supposed to, and I was always in a constant game of catch up. So my lactation consultant, she introduced me to an SNS. We actually started out with a homemade one of these. I used an oral syringe and had actually screwed a tube onto the oral syringe, and I put the tube, taped the tube on me. It was, I probably looked like Frankenstein because I had like syringes coming out and tubes. It was really funny, but yeah, so she actually gifted this to me, which was awesome. So in SNS, the purpose of it is so you actually you put milk in here, or formula, either breast milk or formula, and the goal of it is to where you can still feed your child and nurse your child and give them the nutrition that they need, but you're still stimulating the breast tissue. So this comes in, I guess, 3 parts, but so there's a nice little handy dandy necklace, so you can put it around your neck, which comes in very handy. And this really great thing is a clip, so you can tighten it. There's a cap on it. And then when you open it up, you have 2 tubes. Excuse me, I haven't used this in a while. We haven't nursed in a while here. But if you see, there's little perforated edges. Sorry, it wasn't. There we go. You see little perforated edges, and what you can do is you can put that through. You can put your tubing through there, so it can actually block the milk from coming out, so you don't have to have them both open the entire time. And of course it twists open. You see there's membranes in there. So I have the Medela one, and this one actually came with a couple different size tubings. There was one that was smaller than this and one that was larger than this, so you can help kind of control how fast the flow is. And on the side, it's really handy because it tells you how much is in there, how much you're putting in there. So if you like to keep track like I did, you can keep track of that. So I recently had someone ask how an SNS works. I'm going to kind of explain that. Don't mind my little jerry rig. It's a massager, but I taped a little magnet on there, and that's going to be our nipple. So it's a little homemade, but that's okay. It'll get the point across. So what you do is you put the SNS, or of course you fill it up first with how much milk you need. And it really just depends on the baby, the age of baby. Make sure you talk to your doctor if you don't know how much you need a supplement. So I would always put it around my neck because it was easier. And when I was doing this, I was always very, very cautious to make sure that the strings were up, or else if you don't have the tubing in there and the tubing's down, you're going to get milk all over you. I've had that happen a couple of times. And so sometimes I would even take one of the tubes and I would just wrap it around. And I'm going to have issues right now. I would just wrap it around a couple of times, and then at the very end of it, I'm not at the very end right now, but I would close it off again. So it's kind of, or even sometimes I would have it go in one and then go around and put it back in a couple of times. That way, so there were a couple fail safes in case one of them came out. So what you do is the goal of the tubing is that you're going to want it on the very end of your nipple to where it's kind of going to become flush with your nipple. So if this is my breast and this is your nipple, you would want to make it to where it's hanging out just a little bit over. I'm going to come up a little closer here so you can see that. So it's just a little bit over the nipple area there. So what that's going to do, and you always want to make sure that it's on the roof of your child's mouth. The reason why that is because of is because of how the baby takes the breast into their mouth. But the goal of what you really want for this tubing, and it might, you know, it might be a little different for every woman, but the goal is to be able to get that tubing to the roof of their mouth, so that when your child is nursing, that they're able to suck the milk out just like they would on your breast. It's really awesome. But there is a bit of a learning curve to it. It's, you know, there's probably going to be a couple times when you don't get it right away. There were a few times when I had to latch and unlatch Mick, but that's totally normal. Just keep with it. It's really worth it. You know, with this, I was able to increase my supply. I mean, I was doing a lot of other things, but I really attribute the length that Mick was able to nurse on my breast and the stimulation that my tissues got to that. And, you know, the great thing about this is that there are two tubings, or there are two tubes, and you can tape yourself up. So, you know, I don't have any medical tape around the house. I'm using duct tape today. I would not recommend using duct tape. So, you know, I would always tape it in a couple places. You know, I hope you can see that. I would usually tape it like way up here on my chest, and I would kind of try to guide it in when it was on my breast then. Yeah, sometimes, you know, sometimes it's really finicky and you kind of have to pull it in and out of your child's mouth. I've had it successfully where Mick was nursing before, and I kind of just snuck it in there, and that worked. But you'll know when it's working because you'll see, like, there will be a little bit of air in here, but then you'll be able to see the milk move, and every now and then an air bubble would get in there. But you'll be able to see the air bubble move, and that was always reassuring for me. But I hope that helps. If you have any other questions, please feel free to ask. I would be more than happy to help you. All right, have good luck.